swap seats. So next we're going to have Udayakumar, and he's a senior faculty at Aravind. He has over 10 years of experience leading training for over 175 eye care administrators from 15 countries, and he actively promotes innovation in patient care through ACEI, organizes capacity building programs, collaborates with institutes like IIM and IIT on research. So welcome.
So thank you, Priya. Thanks for that introduction. Hope I'm audible. Yeah. So I am going to present about the salience effect of clinical interventions and disease progression and follow-up adherence of patients with diabetic retinopathy. Okay. So this study was done in collaboration with IIM Udaipur. So as we all know, non-adherence to follow-up is a major challenge, one of the major challenges treating non-communicable diseases across the globe, as well as the continuity of care is also more important in these kind of non-communicable diseases. Understanding the reasons of loss to follow-up is also help us engaging in appropriate ways to reduce the risk. There are some studies which is associated with patients' demographic and socioeconomic factors, but there is a very limited understanding of behavioral aspects which leads to non-adherence to follow-up schedule. So, diabetic retinopathy patients who require periodic monitoring are taken to the study. So, throughout the treatment period, patients are experiencing multiple events such as surgery or injections or lasers, or their disease may be progressed. And this may change the patient's perceptions about the disease severity as well. And the effect of patients' experiences and perceptions on the decisions to delay care is largely understudied. So this study, we focus on studying these perception and experiences, which has an impact or not in their decision making of coming on time or late or anything. So the aim is to understand the salience effect of clinical interventions and disease progression in follow-up adherence of patients with diabetic retinopathy. The objective is to analyze patients' follow-up adherence patterns, which is linked to planned clinical interventions, as I mentioned earlier, whether it is injection, laser, or surgery. So both on the intervention day as well as after the intervention visits, and to inspect how the salience of the disease progression as experienced by the patients through visual acuity influence their decision making in adherence to follow-up, and also how the communication of the doctors about the disease progression, whether that salience is also affecting the behavior of patients' follow-up adherence. We tracked the first 5 visits of the patients after intervention and before 3 visits as well. So, out of 100,000 patients visited Aravind Retina Clinic between 2017 Jan to 2020 March, we randomly selected 5,000 patients who are diagnosed with NPDR or PDR, which includes suspect as well for this study. And we removed 687 patients with incomplete data and 416 patients who had visited the hospital only once, because we are studying the follow-up adherence. And finally, 3,867 patients were selected, and all of them were accounted for 33,690 visits. So in this entire analysis, we are taking in the visit level analysis into consideration. We are not considering patient data. So we are taking the visit level data. And we also did a survey with 100 patients. We asked them to rank the order of importance of each of the interventions. What is their perception towards all these interventions? So the patients ranking for surgery, injection, and laser separately. So where surgery has a more weightage, which stands for 3 marks and in our study, and laser stands 2, and injections the 3rd place in the weightage, I'm saying. So adherence, after the visit, the doctor is giving follow-up date for the next visit, and based on the days of follow-up visit, we also added some threshold window to calculate on-time adherence, because it is not the exact date they cannot come. Clinically, there might be some window as well. So we consider this window period and calculated whether the patient are coming before this window period or during this or after this. Based on that, we categorize them as early, delayed, or on time. And the control variables were demographic factors as well as clinical factors as well. And the methodology conducted was, we compared delayed versus on-time visits, same like early versus on-time visits. And we also assessed the impact of intervention type and the salience and visual acuity changes. Again, for disease progression also, we compared delays versus on-time and early versus on-time. We also measured the communication of doctors and the salience of it in the disease progression influences the patient's adherence as well. And the studies analysis were done through multivariate logistic regression. So if you see out of total 33,690 visits, this is the general pattern. So 52% of visits were on time, and 22% of visits were early, and 26% of visits were delayed. But on the day of intervention, any intervention, the normal pattern changes. If it is a surgery visits, people are more likely to visit early compared to delay or on time. Whereas in the laser, people are more likely to visit on time than the late visit or delayed visits. In injection, again, people are more likely to visit early on the day of injections. So where people are having 2 or multiple interventions on the same day, again, they are more prone towards on-time visits. Where if there is no intervention at all, as expected, it is the delay. People are would like to delay the visits. So same is therefore salience of intervention as well, post intervention. So post surgery, they are more likely to come early. Post laser, they are more likely to come on time. Whereas the injection salience, what they perceive is, it is not that important like surgery or on time. It may be due to the improvement in the visual acuity or their condition for injections. So visual acuity also has a significant influence, and as long as the diabetes is there, so they are more likely to delay based on the duration of diabetes. So severity of disease is also having significant impact in this. And duration of follow-up date, if the follow-up was given more than 2 months, people are more likely to delay the visits. The closer the follow-ups, they are more early or more on time. Again, distance also playing a major role in this. So if the higher the distance, again, more chances of delaying the visits, where age groups is not significant, whereas the gender is also playing a significant role in this. So if you see the pattern in their follow-up visits, so if during the, adherence to, is not clearly visible here. So the adherence patterns pre and post surgery, if you see after the first visit after surgery, immediately the early visit strikes up, then from the next visit it drops up, and on-time visit stabilize. Same pattern is for there for pre and post laser as well as injection as well. So on the first visit, or during that visit, it peaks up, except in the laser part. Whereas in the disease progression, whether it is mild, moderate, or severe, or PDR, the immediate next visit is peaking up, then it is going down, and on-time visits are progressing. After 2-3 visits, it stabilizes. So the effect of clinical intervention on salience of patients' adherence, again, during the clinic interventions, if any kind of intervention is there, they are more likely to come on time if compared to delay. Whereas if you compare early versus on time, they are more prone to come early than on time. Same in the post-surgery or post-laser salience as well. So it seems that after injection, the visual acuity is slightly improving compared to laser and surgery. So that is also playing a major role. So the disease progression. So after 5th visit, they are more prone to, the on-time is more significant. Whereas they are immediately after the visit, they are coming on time. I'll finish quickly. Okay. So I'll skip because this is same information as that. So what is the inference we get from this is, so patient perceives surgeries and lasers as more significant than injections, which is leading to better adherence for these procedures. Improved outcomes in terms of injection is delaying their visit. So visual acuity is having a higher impact. So people experience worsening visual acuity, they are more likely to come early because of the disease progression. So the salience effect of disease progression, so early follow-up is more likely after diagnosis of any progression. So however, adherence drops in the later period as well. And the people's perception is more important than the provider's expectation. And it can be applicable for other non-communicable diseases as well. So to conclude, any understanding of the salience effect will help us in improving the follow-up adherence. And we can also target our communication and engagement strategies with the patients to improve this. And this can be applicable for all the chronic disease management. So thank you.